In the Neolithic era, people lived without metal blades, without hospitals, and without any written medical guides. And yet, thousands of years later, a strange pattern appeared in their graves. Human skulls turned up with holes that looked anything but accidental. They did not match the random cracking of a fall. They did not look like animal chewing. These openings seemed placed, shaped, and intentional. That single fact created a mystery that refused to stay buried. These skulls came from ordinary communities, not from one isolated place, and the holes kept showing up again and again. Some sat near the top of the head, others toward the sides, as if someone had chosen the location with purpose. The edges often looked worked, not shattered. It meant time had been spent on living bone, not just damage after death. So the question shifted. If these holes were made on purpose, what problem were people trying to solve with stone tools and steady hands? Whatever the reason, the act itself sounded extreme. The skull protected the brain, and breaking through it carried obvious danger. Without modern anesthesia, without antiseptics, and without a clear way to stop infection, this operation seemed almost unthinkable. Yet the evidence stayed blunt and physical. A human head, deliberately opened. It suggested planning, skill, and a belief that the risk was worth it. And it left two urgent puzzles behind: how they did it and why they tried. When archaeologists found a hole in a skull, they did not automatically see surgery. A skull could crack in a fall, splinter in violence, or break slowly after burial. So the question became simple and urgent. Did this opening happen by accident or by human hands on purpose? The answer came from the bone itself. It carried patterns that random damage rarely left behind. Under close study, the edges of many holes showed thin, repeated cut marks, like lines laid down in careful passes. The circles looked controlled, not shattered. Instead of jagged fractures radiating outward, the bone showed shaping, step by step, around a chosen center. In some cases, the surface carried tiny parallel grooves, consistent in direction and pressure. That regularity pointed away from decay and toward deliberate work. Archaeologists also compared these openings to known injuries. Battle damage tended to leave impact points, splinters, and uneven breaks. Animal gnawing left pitted, chewed textures. Soil pressure distorted bone in broader, messier ways. Trepanation left a different signature, a planned circle, controlled removal, and a rim that looked managed rather than torn. With those telltale clues, the mystery shifted from what happened to how it was done. Then a different kind of clue shifted the question. Some skulls did not just show a hole cut into bone. They showed what happened afterward. Along the edge of the opening, the bone looked smoother, not sharp. In places it even thickened. That mattered because bone did not reshape itself in a day. Those changes meant time had passed with the person still alive. Archaeologists looked for the simple signs the body left behind. Fresh cuts stayed crisp, but healing edges rounded off as new bone slowly crept over the margins. Sometimes the regrowth formed a partial rim, like the skull tried to seal the breach. That pattern did not match a strike in battle or damage after burial. It matched survival, weeks, months, even years after the opening was made. The implications landed hard. If the bone healed, then the patient lived long enough to recover from the injury and fight off infection. And it did not appear once. It appeared again and again in different burials, on different skulls, in different places. Trepanation no longer looked like a desperate act that usually killed. It looked like a procedure people sometimes got through. Against the odds, many survived. Researchers did not stop at identifying the holes. They tried to remake them. Using stone blades and points shaped like the ones found at sites, They worked fresh animal bone and replicas of human skull thickness. The goal stayed simple: match the marks left behind. When the tool angle changed, the scratches changed. When pressure shifted, the cut widened. The bone recorded every decision. One method relied on scraping. A sharp edge moved back and forth, shaving the bone down slowly until it thinned and finally opened. Another method used drilling, not as one deep plunge, but as many small holes placed in a ring, then connected into a circle. A third approach cut a groove, tracing the same line again and again until a disc could be lifted away. The reconstructions revealed something bigger than technique. The same patterns repeated within regions, as if people followed an accepted set of steps. Some cultures favoured wide scraped openings, others left the neat dotted outline of drilling, others showed long controlled grooving. These were not random attempts. They were consistent procedures, learned and repeated. The skulls matched the methods like fingerprints. By the time the techniques became clear, a harder question remained. Why did anyone take the risk at all? Some skulls carried the answer in the bone itself. Healed fractures sat close to the openings, as if a blow had cracked the head and pressure had built underneath. In those cases, the hole looked less like an experiment and more like an emergency. The placement followed the injury. The action suggested treatment. But other examples refused that simple logic. Some openings appeared on skulls with no sign of a fresh break, no matching trauma that demanded relief. The holes sometimes sat in consistent, chosen spots, repeated from one burial to the next. That regularity changed the meaning. It hinted at decisions made for reasons beyond repair. The cut became a message, not just a measure. The motive started to split into more than one path. Burial context pushed the idea even further. Certain trepanned individuals were laid to rest with special care, or with patterns that suggested the community noticed the altered head. In a few cases, the opening seemed placed where it would have been seen or remembered, even after death. That made the act feel symbolic, possibly tied to belief, status, or protection. One practice now carried two impulses: to heal damage and to mark meaning. For a long time, trepanation sounded like a local oddity, something that happened in one place for one strange reason. Then the map changed. Similar openings turned up in Neolithic graves across Europe, and they matched in the ways that mattered: deliberate cutting, controlled shape, and signs of healing. The more skulls researchers studied, the harder it became to call it coincidence. And it did not stop at Europe. Evidence appeared across North Africa and parts of Asia, then in the Americas, including the high Andes. Cultures separated by oceans still left behind skulls with carefully made holes, not random breaks. Methods differed, but the goal looked familiar: breach the bone without shattering it. That spread forced a new question, not whether it happened, but why so many groups kept doing it. Once trepanation showed up in region after region, it stopped looking like a single invention and started looking like a human pattern. Communities faced head injuries, seizures, pain, and fear, and they acted with the tools they had. Some treated trauma, some followed ritual, but across distance and time, people reached for the same bold solution. A hole in the skull became a shared tradition, not an isolated curiosity. Then the evidence became more personal. Some skulls did not show one trepanation, but two, sometimes more, on the very same person. And the edges told a clear sequence. One hole healed first, another came later. That meant the patient lived long enough to be operated on again. It also meant somebody remembered how to do it, how to find the right spot, and how to stop before the brain was damaged. Across different burials, the openings began to look strangely consistent. Many holes fell into a narrow range of sizes, not random chips or wide fractures, but controlled circles and ovals that repeated like a pattern. That kind of regularity suggested measuring by eye and working to a familiar template. Mistakes still happened, but the goal stayed the same. This did not resemble a desperate one-time act. It resembled a practiced procedure. So the question shifted from could it be done to who kept doing it. Repeated operations and standardized sizes pointed toward people in the community who held the know-how. Individuals trusted to cut into the skull and manage the risk. Their role did not need a written manual to exist. It just needed training, experience, and a reputation that survived success and failure. In a world of stone tools, that kind of skill became a social position. As metalworking spread, the tools changed first. Bronze blades and iron points replaced stone scrapers, and trepanation entered a new phase. The opening could be cut faster and with cleaner edges, but speed carried its own danger. A slip bit deeper, heat and pressure rose, the bone could splinter. What once depended on patient scraping now depended on controlled force, and that demanded a different kind of skill. These new tools also changed what the operation looked like in practice. A surgeon could incise, pry, or drill in ways that stone rarely allowed, shaping holes with sharper margins and more regular outlines. That sometimes reduced the time a patient stayed immobilized, but it also increased bleeding and the chance of piercing the covering of the brain. The technology promised precision. It also amplified mistakes. At the same time, early written medicine began to record reasons for opening the skull in clearer terms. Head injuries and fractures appeared as problems to treat, not just mysteries to endure. Practitioners described pressure, pain, and disturbed behavior as signs that something inside needed release. Trepanation shifted from a largely inferred tradition to a named procedure with stated aims, and expectations tightened around results. Modern archaeology brought a different kind of evidence. Instead of judging a hole by its shape alone, researchers tracked the tiniest scars on the bone. Under high magnification, stone tools left microstriations, fine, repeated lines that ran in specific directions. Those patterns acted like fingerprints. They separated scraping from drilling, careful cutting from rough breakage. Guesswork shrank. The bone itself recorded the method. Medical imaging tightened the timeline. CT scans and 3D reconstructions showed the thickness of the skull around an opening and the subtle stages of healing. Fresh cuts looked sharp and clean. Survival changed the edge, rounding it as new bone formed. Partial healing marked days or weeks. Complete regrowth suggested months or years. Timing mattered because it separated a procedure from a post-death alteration. It also revealed complications. With those tools combined, intent became easier to test. Imaging traced surgical pathways, showing where a practitioner started, how they widened the opening, and when they stopped, often just short of dangerous inner layers. Microstriations showed hesitation marks and course corrections, signs of controlled work rather than violence. And when healing matched that pathway, it pointed to care, not accident. Technique, timing, and purpose finally sat in the same map. Modern brain surgery relied on things earlier healers never had. Anesthesia removed pain and sudden movement. Antisepsis reduced the invisible infections that once killed quickly. Precision imaging showed surgeons exactly where to go and where not to. Each advance narrowed the danger, yet the basic fact stayed simple. a human skull still had to be opened on purpose, and that choice still carried a brutal risk. That was why the ancient skulls mattered so much. They showed that this step had been taken thousands of years earlier, without metal, without microscopes, without antibiotics. Stone tools cut, scraped, and drilled through bone, slowly enough to control the work, but fast enough to keep the patient alive. And then the bone sometimes healed. Not a crack, not an accident. A planned opening, followed by survival. Those healed edges turned speculation into evidence. They meant people had endured the procedure and lived long enough for the body to rebuild the rim of the hole. In the modern world, that result looked less like a primitive stunt and more like an early form of surgical thinking, method, restraint, and aftercare. Neurosurgery later became cleaner, safer, and guided by machines, but it started with stone and nerve.